One of the most popular treatments in all of plastic surgery is injectable treatments, and you can consider these minimally invasive, non-invasive, but the treatment of the signs of aging via injections is something that now has been done for decades.
Injections come into two broad categories, with neurotoxins under the brand names of Botox and Dysport, and then the other category would be the filler injections. Botox and the toxins are meant for expression lines, typically of the upper face. Filler injections are typically for volume loss, where we see some shadowing or creases of the cheeks, of the nasolabial folds, which is that line between the nose and the corners of the mouth, as well as the chin and marionette line areas.
Botulinum toxin usually targets muscle movement, and this is to treat animation lines in the face. This takes the form of glabellar lines, which a lot of patients refer to as the 11s in between the eyebrows, horizontal forehead lines, crow's feet, smile lines, and it will treat anywhere where muscle action is responsible for the creation of the line. In contrast, filler injections are done to replace volume and also to help reshape contours. So typically these are used for the lower face rather than the upper face. Nasolabial folds, marionette lines, sagging corners of the mouth, the jawline, early jowl formation, or simply loss of cheek volume due to weight loss or aging.
Botox injections do have to be repeated, as their effects are temporary, since the muscles do self-repair over time and will need renewed injection. But the great thing about Botox injections in general is that they will prevent lines from ever escalating and becoming permanent.
Injections typically last between 2 and 6 months, depending on what muscle is being treated, how often the patient has been treated, and a lot of it has to do with your individual biology. The fillers behave the same way. Most of the fillers out in the market are made of hyaluronic acid. This is a substance that blends and plays well with our own soft tissues. So a lot of it has to do with genetics, how your body processes these products, and there are minor differences between the different brands and the different products so that we can see what works best for you.
Lip fillers are a special application of filler injections, whereby we use the fillers to enhance the anatomy of the lips, either by just smoothing the surface and the texture of the lip tissues themselves, or in some cases to actually enlarge the lips.
One of the most popular indications for filler injections is augmentation of the lips, and to a lesser extent, augmentation of the chin if you have a poorly projecting chin. Lip injections can be done for pure volumization, and this is usually the younger age group that would like to have the lips be more visible. In more advanced age, a lot of times replacing the volume on the lips can be very helpful in minimizing lines and wrinkles that are visible or that affect the look of makeup or lipstick.
Kybella is a very interesting product in that it is an enzyme that helps melt away fat. So we can actually now do non-invasive targeted fat elimination by injection alone. As an enzyme, it is actually considered natural to the body and can be targeted in areas such as the upper neck, as well as the jowl area, and even some cases some small pockets of fat, including the anterior bra fat that some women complain about.
Kybella is something that will target fat chemically. It will emulsify and digest the fat cells where you inject it. It's local acting, so multiple injections are necessary to treat a specific area. The FDA approval is for fat under the chin, and injections can be done in off-label areas. One of the things to know about Kybella is that it may take 2 to 3 injection sessions in order to get to that result that you want, because only a certain percentage of fat cells are going to be destroyed by each injection session. It is important to know that there is a swelling period of 5 to 6 days after the injections, and it takes approximately 6 weeks for you to see the result of an injection session. At that point, you come back into the office. We decide together with the patients whether it is appropriate to inject again.